Hello and welcome to yet another episode of Orthopedics Made Simple, making no bones about it. I am Dr. Naveen, consultant orthopedic surgeon and founder of SCOT. What am I going to talk to you about today? I'm going to talk to you about the biggest lie that has been peddled for ages, or the biggest misconception that people have. What is it? We orthopedic surgeons heal fractures. There can be no bigger lie than that. Let me explain. You're confused? Let me explain. A fracture is any break or discontinuity in bone. The very moment that your bone breaks, it will start healing on its own. Yes, it will start healing on its own. It is nature that heals and unites fractures. Then what is our role? Our role as orthopedic surgeons is to facilitate the fracture healing, to hasten the process of fracture healing, to ensure that the bone heals in the right position, to ensure that the alignment of the joints is proper. Our role of orthopedic surgeon is to ensure that the patient gets to use that bone or joint immediately as soon as possible, or in case if it's a lower limb fracture, to ensure that the patient gets onto his or her feet immediately or as soon as possible. This is where the biggest tiff between us qualified orthopedic surgeons and unqualified bone setters comes. The reason being, as I said, fractures heal on their own, and 90% of the times you don't have to do anything. Forget the time period that it takes to heal. Even if you go to a native bone setter, 90% of your fractures are going to heal. But do they heal in the right position? Are the joints in proper position so that you get back full movement and no stiffness? Have you ruled out any damage to the blood vessels and nerves so that you avoid long-term damage? Are you back on your feet as soon as possible so that you can get back to your normal lives as soon as possible? And in old people, lying in bed for one day more than what is necessary can be life-threatening. So have you ruled out all those things? That is the difference between us orthopedic surgeons and the traditional bone setters. The goal of modern orthopedics is to ensure full mobilization and immediate mobilization. Or in short, as I always keep saying, one should always keep moving and keep moving without pain. That is the role of an orthopedic surgeon in fracture healing and fracture treatment. Healing of fractures is nature's job, and our job is to help nature. Thank you, and catch you in the next episode of Orthopedics Made Simple, making no bones about it. Thank you.